low carbohydrate, whatever that means, does seem to work for some. Ketogenic does seem to work for some. What that is unclear. Like it varies across the different papers. The best study that I think, and I've spoken about this with some of my peers, is if we were to do a study that was low carbohydrate, so removal of processed foods, whole foods, removal of ultra processed foods, focus on everything that your grandmother ate, like real food, either that and then a low carb version of that, or that can be the low carb version. Okay, so that versus a ketogenic approach with very specific therapeutic ketogenic macros, which is, what I do day to day in clinical practice, where, we'd be looking at maybe a 1.5 to 1 up to a 2 to 1 ratio. So this is more like a moderate Atkins diet. This is what seems to be working quite well for like depression, anxiety, schizophrenia, bipolar. Doing that and then having people test their ketones, just like you mentioned, their blood ketone levels, tracking their food on an app to make sure that they are hitting those macros every day, because it's very difficult to reach the high fat level, and then comparing the two. Because I think the outcome there would be that the removal of ultra processed foods, I mean, absolutely, people are going to feel they will be improved. They're going to have more energy. They're likely to have less anxiety because their blood sugar levels are going to be more stable. So they're going to have less drops after the carbohydrates, and therefore they're going to feel the cravings for binges less, and so
Yeah.
on. So they'll definitely be improved. Maybe you even throw on a control arm of just standard, diet as usual with,
Yeah.
whatever medications people with binge eating disorder are taking, etc. So they'll be improved, yes. But then when you compare that to the people who are following a therapeutic ketogenic approach, I
Mhm.
do think there would be a difference then again between the two. I think the people in the ketogenic arm that are testing ketones, once they get their ketones into a specific range, what I see clinically is that that voice chatter just goes to bed, which is unbelievable. And it can be like night and day. Like as soon as people get their ketones into that range, it's quiet.